This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what happens if your ACL tear goes untreated. If you like this video, we put out new content weekly, so please like and subscribe. So your ACL ligament in your knee, it basically prevents your shin bone from moving forward on your femur bone. There's some rotational elements of it as well. It actually can get fairly complicated. There's a lot of studies about the biomechanics of the ACL. But anyways, what happens if your ACL tear goes untreated? Well, if you tear your ACL, no matter whether you get it reconstructed or you don't, you're going to get arthritis down the line. They used to think that reconstructing an ACL would prevent arthritis, but for whatever reason it doesn't. So if you tear your ACL, whether you get it fixed or not, you're going to develop arthritis about 20 years down the line. So very commonly, you see people in clinic, they're in their 40s, 50s, 60s, and they have knee arthritis and they tore their ACL and got it reconstructed 20 years ago. So whether or not you get it reconstructed, you're going to develop arthritis in your knee. High probability, that's long term. So what happens in the short term? So if you have an ACL tear, the common thought is you need to get it reconstructed, and that can be true, but the ACL contributes to knee stability. So if you feel that in your knee, some people tear their ACL and they're able to kind of rehab it, and they get to a point where it doesn't really hurt anymore and the knee feels somewhat stable. So in that case, if you don't get your ACL reconstructed, you might not really notice anything. Other people, if they don't get it reconstructed, especially if you're younger and you play sports, you might notice that you're not able to do the activities that you like to do that involve cutting, basically unanticipated movement like playing basketball or soccer or sports like that. You might notice that those sports are harder to do because your knee will hurt and it doesn't feel like it's stable and you can move on it. This isn't true for sports that have anticipated activity as much. Like you can still run with no ACL, but you can't really cut and move too well without experiencing, generally speaking, pain and instability. So again, if you tear it and you're active like that, you may notice your knee doesn't feel good and it just hurts and gets swollen and you can't play those sports. But if you don't do those sports, you may not really notice much of anything. Maybe your knee feels a little wonky. And actually, there's a whole host of people who never report tearing their ACL, but you get an MRI later in life and you find out that their ACL has been torn for 20 years. So yes, to sum it up, if you tear your ACL, you're going to get arthritis pretty much no matter what. We don't think that reconstructing the ACL really changes that aspect of your knee. If you don't have any symptoms and you're not doing a lot of sports or you're cutting, then you might not notice anything. If you do those sports with no ACL, you might notice it's very difficult and your knee really hurts. So I hope I was able to answer your questions about what happens if you don't get your ACL reconstructed. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. And if you like this video, we put out new content weekly, so please like and subscribe. And thanks for watching.